That's right. Hi, good morning. Welcome to Midwife Monday. We are doing comfort measures in labor today. I will be the pregnant person. And I have joining me today Rachel Myers from the Birth Co-op, who is a local doula serving the greater Los Angeles area. She also teaches with her partners, correct?
Yes.
The Birth Co-op, they teach childbirth education, breastfeeding. Do you do breastfeeding?
Yeah, a little bit.
Breastfeeding, baby basics, mending mamas.
Yeah.
They have a facility in Van Nuys, and they're also here at our birth center doing their whole series as well. And so she's going to share with us how doulas help and how they help in either home birth, hospital birth, birth center birth, just those basic comfort measures. So I believe most of the people probably watching these Facebook Lives are having hospital deliveries. So we want to make sure that you know what tools are really useful to help if you're trying to have an unmedicated delivery. Doulas are awesome, even if you're having a medicated delivery. If you're planning on getting an epidural, having a doula is still really essential because you don't necessarily want that epidural until you're in a good, strong, active labor pattern. So that would be about the 6 centimeter mark. So leading up, that early labor is really, really critical for some people if they're birthing in the hospital to have some labor support. Do you agree?
Totally agree.
Yeah.
Yeah, and sometimes people think that just because they're getting an epidural, maybe they don't need support, but it is still a lot of work to get a baby out, whether you're medicated or unmedicated.
Right.
And having that level of comfort, of information, and of support, I think just goes across the board in importance.
Really important, especially if you're on an epidural, so you're not going to be sitting on a ball and doing all of those things out of the bed, but there are still things that you're doing in the bed that doula can really help with rotating your position, getting that baby optimally aligned where the baby's back is on your left side and the head is down. So that way when that baby comes into the pelvis, it's more optimal, right? So it can come into the pelvis better, so you're more likely to have a vaginal delivery. And sometimes with epidurals, when you lay down on the bed, I'll lay down this way. When you lay down on the bed, those babies tend to rotate. This is the back. Those babies tend to rotate to a posterior position and make that diameter much bigger, and it's much harder to get through the pelvis when that baby's looking up. And oftentimes with epidurals, not that you shouldn't get an epidural, but things to know about that is if you get it too early, it will certainly increase your risk of some cascading of events, and such as maybe augmentation with Pitocin, epidural, C-section. And mostly it's because a lot of times those babies rotate because they rotate with gravity, right? So ideally, all the positions we're going to show today are pretty much forward-leaning positions to help keep that baby's back forward. Whereas with epidurals, you're sort of you are reclined with a little bit of a wedge, right? So that you're not, it's like the wedge is on your right side, so that you're slightly tilted, but you're kind of on your back. So those babies will actually rotate to I'm going to take the baby out of the bag of water. Oh, my water just broke. Oh my gosh, the cord's around the neck. Woo! Good thing we fixed that problem. Okay, so babies tend to be, we've talked about this a lot, optimal fetal position is a head down, chin to chest, baby's back towards mom's belly on the left side, right? That's an optimal position because as those babies come through the pelvis, right, they come in this way and then they make a rotation where the back is totally anterior, and then, ow! Okay, my wrist is still a little bit sore. And then they come through, and then the shoulders come through, and then we have a baby. So sometimes with those epidurals, moms will recline and the baby rolls to a posterior, right? And now we have a baby that's in this posterior position. Ouch! And that head is much bigger, if you can see that, much bigger coming through the pelvis. And then you get to 8 centimeters and you arrest, right? Okay, I was at 8 centimeters for 5 hours and I never progressed. The baby never fit through my pelvis and I needed a C-section. So we hear that often, and sometimes that's correct, right? The head doesn't fit through the pelvis because of the position, and it does create the need for a C-section. So no debate on whether that C-section was appropriate or not, because it probably was, but perhaps if you had some labor support during that laboring time, the doula or your midwife, if she's there, whomever's with you that's a birth person, will help you change your position. We're going to show you those so we can keep this baby optimally aligned. So doulas are not just for hospital. Doulas are also for out of hospital. Doulas are for women that are planning on getting an epidural, but they want to maybe increase their likelihood of a vaginal delivery. They really want to avoid having a C-section. So doulas are really, really helpful for that. They're also really helpful for the partner because it's, as you know, it's very stressful for the partner. And the doula is there, right? Do you agree?
100%. I love working with partners, and so much of my job is making sure that they feel like they're part of the picture, because often what they hear is that they're the least important part of what's going on in the room, and they really get cast aside. So always making sure that, number one, they know what's going on, they understand what's happening, they feel empowered to ask questions, because some don't even feel like they can ask questions.
Right. They're often very marginalized when you get to your birth location. If it's a hospital location in general, not out of hospital, we're definitely including the partners. But in a hospital setting, you get in and I mean, the stress is high. It's a big event and there's some discomfort going on. So the dads are often said, okay, dads, have a seat over there. Everything is fine. And the partner sits down and then feels kind of stuck on that couch and doesn't really know how to engage and insert themselves into that picture, because moms are sort of on this bed and there's an IV in one arm and they can't really move much. But the doula is there to really integrate that dad into the situation. Correct?
Yeah, the dad or birth partner. And I will also say that luckily, because of doulas being so common in the hospitals and us turning out such good educational classes where parents feel so informed, like 10 years ago, 11 years ago, when I walked in the hospital holding this, you know, I got laughed at. And I literally had a nurse look at me and say, oh, a birth ball, that'll be a cesarean. But that's not how it is. In our local hospitals in Los Angeles, obviously in places like birth centers, they have these tools. But it's not uncommon for them even to have these already or to bring them.
Right. The one hospital that we mostly transport to in non-emergent ways here at the birth center, that hospital has birth balls and peanut balls.
Awesome.
And the evidence shows that doulas decrease the rate of cesareans. Doulas have a positive outcome on the mother's experience. It is evidence-based, and many, many hospitals and nurses and doctors are taught that doulas are very useful. I do a training called Advanced Life Support in Obstetrics, and I do it every couple of years, and it's for doctors and residents on managing really critical situations in a birth setting. And they're taught in that training that doulas are very helpful. So we know this is a proven thing. It's not just a fad. It's not just, you know, it's not just for women that want to go natural. It's not. It's for women that want to have a positive birth. It helps them have a positive birth experience, less postpartum depression, and decreases the C-section rate. So here we go. We're going to talk about some comfort, some basic comfort measures. The first one, super simple, is this lovely birth. We call it a birth ball. People call it a yoga ball, an exercise ball, but it's just basically a big old ball. And then
the reason that I love this birth ball is because it's so versatile and it can go anywhere. So it can go with you into the bathroom if you're feeling like you need a little bit more privacy and you want to labor on the toilet, which is an amazing supported squat position where you're using gravity, but your partner, your doula, can sit right in front of you when you're on the toilet. This can be taken as a stool anywhere around the room.
So totally funny story. I was doulaing. So I was doulaing back, 19 years ago, and I had my ball, and we were at a hospital, and I put it in the shower, right? So the mom is sitting on this ball in the shower, and I'm doulaing her, and I'm, doing my thing. And what I didn't realize is that this ball was covering the drain in the shower. I didn't know it, and we were in there, and suddenly, and I don't know, I wasn't aware of the fact that my feet were getting wet. I thought they were getting wet because of just the water coming from the shower. We flooded the room. We flooded the room. Like, it poured out into the labor room where we had to actually get, like, the guys that come in and, like, fix things. Like the maintenance guys. Yeah, and it was because the birth ball was covering the drain in the shower. So it was awesome for this woman in the shower because she was sitting on it, she was leaning forward, and the water was hitting her back, and it was great, and it did flood the entire labor room. That was me.
Okay,
So
that might have been why 10 years ago I got looked at with that look when I brought one in the
probably.
hospital.
So birth balls are awesome prenatally. They help if you're sitting and you're watching TV or you are working a lot at your computer. They're great to sit on. If you can see when we sit on it, you get your legs really far apart, right? And so you can really move your pelvis around. You can roll your pelvis. It's really good for your back. But yet it also keeps you, could you hand me that doll? It also keeps you straight up versus the position that many people get into is they sit on the couch and they lean back and they put their feet up, right? Which encourages that baby to go into a posterior position. But sitting on the ball keeps you upright or even forward because you can't lean back, otherwise you're going to fall off the ball. So prenatally, it's one of the things we encourage our moms to do to help get this baby, again, in that optimal fetal position, right? And then, so what would you do? I'm like, okay, so I'm having a contraction. Oh, I'm having a contraction. Oh, gosh, oh my God, I'm having a contraction.
Take some deep breaths.
Oh, boy.
Okay, so what I'm going to do right now is
because you know I used to be an actress.
I'm just going to warm up my hands, and I'm going to put some pressure right here on Renee's tailbone. And as she's breathing in through your nose, out through your mouth, slow down your breath, in through your nose. Nice, beautiful birthing sounds. I love that big deep exhale. But all I'm doing is I'm putting pressure in a downward position on her tailbone.
I'm totally having flashbacks.
Don't push. Don't push yet. You're not ready. So what I'm doing is I'm filling up some of the sensations in her body that would usually hold pain, the pain receptors, and I'm flooding them with some pressure and with hopefully some pleasure. So I'm actually literally taking away her ability to feel pain by giving her feelings of comfort.
It's also called the gate control theory, right? So when we have more than one sensation in our body, the sensations sort of disperse, right? So all your senses, if they're being used during labor, it makes the sensation of the contraction less. So many doulas will have essential oils on their hands, heat, cold. There might be some relaxing music playing, so my sound is occupied, my sense of smell is occupied, then the sense of touch is occupied, and then moving. All of those things, called the gate control theory, decrease the sense of pain.
And sometimes just turning off the lights is the best gift that you can give a laboring woman because she feels more private and safe. And if you are in a hospital setting where it is a little bit more loud and busy than it would be at home or a birth center, people just kind of get the vibe of the room. When they come in and they smell lavender and they see the lights are down, usually they start talking.
They start to whisper. And remember that all animals, birth is not a spectator sport, right? So we birth best where we feel safe. Mostly if you have any pets, cats, dogs, or whatever, you've seen them birthing and they go into a dark closet. Humans, we do the same thing. We need that dark, warm, private little nest to have our babies in. So by going into the hospital, you can shut the lights off when you walk in. The first thing we do if we transport is, I know where all the light switches are. I ask the nurse, is it okay with you? We're going to lower the lights right now. And as long as there's enough light for your care providers to see what they're doing, there's usually no pushback at all for you to lower the lights in the room. You can adjust the temperature in some of the hospitals you can't.
It's hard to.
But the one that we go to, they have individual thermostats in each of the rooms, so you can adjust the temperature. You can use essential oils. You cannot light candles, but many doulas have little electric, like those battery operated candles.
And we have strings of little fairy lights that we string around the room.
Yeah, so lowering the lights, using any of those essential oils as long as mom is comfortable with them. And then the nurses, they're usually very, very receptive and are most of the time welcoming of having that labor support.
Yeah. And the truth is that you're paying for a service. So I always tell my clients that if you don't like the people that are in the room with you, you do have a say in going out and letting the head nurse know, you know what, I'm sure she's a wonderful nurse, but it's just not feeling good for us as a great fit. And they'll get you somebody else. So I tell people all the time, don't hope. I hate when I hear clients say, oh, I hope I have a good team. I hope I have the right nurse. this is a time where you create it.
Yeah.
And if you have a nurse that walks in and is like, oh, lavender and a birth ball, she probably doesn't want to be with you for the next 12 hours either.
Right.
So it's
right.
always okay to find the right fit.
Yeah.
So you feel safe.
And you can make adjustments to that environment as long as it's not risking, obviously, the health of you or your baby. So as long as they do want to get you on a monitor. So sometimes the tricky thing with this ball is that toco, right? You have your fetal monitor and your heart and your contraction monitor on. And so sometimes this leaning forward position really compromises picking up the baby's heartbeat. Do you have a trick for that?
Well, usually...
Because it's super low, usually that monitor is way down here.
Usually what I see is that nurses are experts at getting it in a good position if you really advocate and say, I don't want to get back in bed. So I've seen them, and this is a trick that I use, like take a washcloth and roll it up, and then they wedge it under, and it holds.
And some hospitals now have wireless monitors, so you can always request that.
Yeah, they're awesome.
Certainly at one of our hospitals, they have those, and they're just, they stick on, and those work really, really well. So you can be walking around the halls, and your baby can still be monitored appropriately for whatever's going on for your labor.
I want to show you the double hip squeeze, which is an amazing...
Should I stand or stand on this ball?
You can do exactly what you're doing, which is the beauty of the ball. So what I always start off with is warming up my hands, because like Renee said, sometimes just a little bit of heat or a little bit of cold is all that you need. So what I like to do is stick my palms in where the dimples would be, and I have a bad wrist, so I push my hands together so I face my fingers toward each other because I get more traction that way. And what I do is I go in, but I also go up. So I'm pushing her up as well. So I'm taking all the pressure off her hips, and then I'm pushing it forward. Okay?
And one trick with this ball is if you put it actually on the corner of the bed,
you wedge it.
It's better because then your knees aren't smashing into the bed. So, and the hospital beds go up and down, so you can make it at the appropriate height. So if you don't want to be leaning down or you don't have enough of these big giant pillows, you can get that bed way up here. Just raise that bed all the way up, and so you can lean forward. And that double hip squeeze is great for partners.
Yeah.
Because they have just more strength
so
in
much
general.
strength in long forearms usually.
Yeah.
Now the key with any comfort measure that you're doing is that partner needs to be in an ideal position where they're comfortable and their legs aren't locked out, their neck isn't tweaked, hand in some weird position, because there is nothing more annoying than if you're doing something that feels amazing during a contraction and partner has to stop because they're uncomfortable.
And then it's, no, my back.
Oh, sorry, honey, my knees really bother
My back.
Oh, I'm sorry, I can't. That might elicit some curse words.
And the back situation, you have that doll? The back situation, so remembering what's going on as this baby's coming through the pelvis. Okay, you have your sacrum. Our little doll's pelvis is missing its coccyx here, but you have the bones down here. And so as this baby is coming through, the bones, I mean, there's some legitimate action happening back here at that sacrum. The sacrum is pivoting out. So your bones are moving. So what we tell women in labor when they say, oh my gosh, my back, it's like, right, just visualize that baby's head is coming through your pelvis. So you want to really breathe into that space and make sure that you don't tighten up your butt and tighten up your legs, but just roll with it. So you can just allow that head to come into that space and know, oh, that's my baby right there. It's okay. It's not pathological pain. You're not breaking any bones. It's just your baby coming through, and that's what it is, and it's okay.
And in early labor, so much of the comfort measures that we do are up here. So pressure,
right, because it's like,
massage,
I'm having one.
Relax your shoulders. Relax your shoulders. Let it wash over you. Just imagine it's like a wave. You're going to go up the wave. You're going to come down. But then as we get into more active labor and baby goes farther and deeper into that pelvis, and we really start all those rotation of the muscles and the ligaments and the bones start to shift, we see a shift in her behavior and also a shift in where she finds comfort. So then we really end up focusing our comfort measures pretty much from here to her butt. Sometimes all she wants in active labor is just her butt rubbed, and that's it. So it's also important for partner just to take a mental note of where she's feeling it in her body, and focus your efforts there.
So often in early labor, we just go, oh my gosh, right? We just lift way up and we tighten all of our muscles. And now the pain of the contraction increases exponentially. So the goal of who's ever supporting you is to just see where you hold that tension and then put their hands on that spot, so generally the shoulders, and say, take a deep breath, drop your shoulders, and your hands are clenched and your feet are clenched.
Relax your toes. Let it wash over you. Relax your shoulders.
And then truly, 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 the pain decreases significantly as soon as you isolate just the uterine muscle. And remembering that a contraction, it's just one muscle of your body working. Your whole body does not have to be contracted. So if you ever lift weights, we talk about how, you'll lift some weights and say you're really trying to build up some forcep muscles. So you're working hard, right? You're lifting some heavy weights. So the work of the contraction is like the lifting of the weight. And then as soon as you release the weight, there's still residual ache in that muscle, right? Because you've just worked that muscle really hard. But it's no longer contracted and working. It's just fatigued from the work. The uterine muscle does the same thing. It's the going up, which is about 30 seconds when you're in active labor. It's the going up to the peak. And then after it peaks, after about 30 seconds, every breath thereafter is that muscle releasing and releasing and releasing. And then when it's over, women are still like, but everything still hurts. Everything still hurts. Well, it's just that muscle is fatigued, right? And so reminding the laboring person to just take some deep breaths and let it go and allow yourself to have that recovery time, right? You
take a break and wait for the next one. And I also like to use the analogy of a wave. So I like to breathe people up the wave and then have the wave peak, feel them being brushed to the surface and the sunshine on their face. And then the decline of the wave as all the energy is bringing them back down to the ground. And then I like to take a second and say, feel your feet back on the sand. Because you, like you said, you need to have that release so you're not still in this.
And we remind people too in active labor that it's usually about 5 breaths to the top of the contraction. That's it. 5 breaths. And we count with them, as that contraction is building, and then we can see, right, as the birth people, we can see when a mom peaks. I don't need to see it on a contraction monitor. I can just see it in her behavior. And then we say, well, there's the top. And now it's releasing. So remember, each breath, it gets easier and easier and easier. And then that back massage stuff is kind of dope, just saying. Okay? So the ball is your friend, and not just to sit on.
Yeah, but to exercise on, like you said. I always tell people when you're leading up to labor and birth, replace some of the time throughout a day that you'd be on the chair or on a hard couch, because that closes off your pelvis, to being on this ball, doing your rotations, your hip rotations. It really helps.
It's also really helpful if you are at home and you really want, most women really, or laboring people, really do want to be they really want to be forward, because you want to take that pressure off your sacrum. So any forward, intuitively, women drop forward. It's just what they do. They drop onto the kitchen counter, and then you want to drop and really move your hips around. So sometimes that ball is excellent for up on the bed. So I'm going to go in this direction so I don't show my unders. But always getting your legs real wide open is because, again, we're trying to get this baby through the pelvis, right? So, and then leaning forward just on the ball. And because your wrists will get really tired. And if you're like me, I can't put any weight still on this hand. I can't be doing this for hours. Plus, I want to be a little bit higher up to help that baby, just give that baby some room. Right? So leaning forward on this ball is really helpful. And all those double hip squeeze and massaging, all of that can be done. And then that scarf here that we have, which is also called the rebozo. Rebozo is just Spanish for scarf.
So I love the rebozo because it helps take pressure away, and you can use it I've used this in so many positions. So
if you're in the hospital, or even here, you want to cover this ball, because you don't know who's been on this ball. I know who's been on this ball, so I feel comfortable laying over it, and we clean it, and I know because I'm the one that cleans it. But if you're not using your own ball, or even if you are using your own ball and it's on the hospital floor, you always want to cover this with some kind of sheet or towel, or...
You can also ask for a trash bag, and you put it in a trash bag and tie it, and that protects you if you're in the hospital. But I still say put a towel on top.
Yeah, because it feels
if you're
better.
with your bare butt on this and it's been rolling around the hospital floor,
gross.
So, yeah. So this one is my kids' favorite. They constantly take my rebozo out of my doula bag and ask me to shake their apples.
And a rebozo is nothing special, friends. It's a scarf. I mean, they do make absolutely beautiful rebozos that you can buy, but you don't need to go buy anything special. You can just get a nice long scarf. Or even if you're at the hospital, you could just use a sheet.
Yeah. So what I do is I'm just making sure that this cradles Renee's whole bottom, and I'm tightening it on the side.
You can make sure my unders aren't.
Yeah, you're good. And then, so I'm not going to do it too vigorously because this is PG. And I'm going to shake like this. And sometimes that just brings so much relief to the stomach, the butt, the sacrum, the hips.
Imagine if I was pregnant, it would feel good. Not being pregnant, it kind of makes me want to barf a little bit. That's a funny feeling. But it does.
For that too.
Yeah, but we do this with women, and it's really, pregnant women absolutely love it. And then there's also, do you ever do it this way?
I do sometimes, but when I do that, it's more to cradle the stomach, and I do it to, you're in a strange position for this, but what you can
Which
do,
position should I be in?
just sit up on your knees for a second. And what you can do is you can hold that. Yep, just like that. Don't put pressure on your wrist though. And then just do a little lift.
Me?
So yeah, lift your belly. Yeah, you can shift, or you can just lift your belly.
Do I want to shake? Oh, that's interesting. Yeah.
But I like to tell people, especially if when they're pregnant, they're experiencing a lot of pressure in their hips.
Yeah.
Just do a little tummy lift.
So this would also be really good for those mamas that we have that sort of have a pendulous belly where it kind of hangs forward, and we really want to get that baby's head. We talk about getting, so if the baby's sort of leaning all balled up and kind of forward in your body, we want to get that head in the hoop. So we talk about doing some exercises, but this would lift the baby and lift that baby up and into the hoop. So that would feel really good.
Yeah. I'll show you one really cool thing I did.
So that's just a scarf, and it works great.
I did this one time on a home birth for dad, because I could see, I get between my knees.
Facing you or facing out?
Facing out. So he was just kind of like,
My knees?
Yeah, no, either way. She was just laboring in front of him like this, but he didn't have this nice comfortable bed.
So if you're laboring in front, you're probably like...
Yes, perfect. So he didn't have this nice comfortable bed with all these pillows behind him, and we were like on hour 2 of this home birth, and he was on the hard ground, and I could see that he could, at this point, like barely stand up. So I took my rebozo.
You're only 2 hours in?
But he had been in this position, like with his neck.
Oh, for 2 hours, okay.
And his back sitting up.
That's a long time.
So I just put my rebozo around him, and then I gave the mom the rebozo, and as she was laboring, she just kind of bared down and pulled the rebozo forward like that, and then it automatically popped his back up and gave him back support. And he looked at me like, oh, thank you.
Oh, that's good. And the other thing about this rebozo, we do what's called a tug of war, and that's a pushing situation. Do you ever use it not pushing?
I use it for comfort and baby position. Okay.
So pushing, especially if you're in a hospital setting, it can be really helpful because you're often in this semi-reclined position. Feet are up in stirrups or foot pedals, perhaps, or maybe they're still on the bed, and you're trying to, you're pushing. This goes around the birth partner.
Or you can go like this. And then I just hold it like this.
Yeah, and so if...
now this could be around a push bar on a bed in a hospital. They have these bars that attach, and I've put it around the bar before.
Yeah.
I've had a partner hold it before.
And then,
I held it.
Right, and then when the pregnant person is pushing, she's pulling back on this. We just posted a picture on Instagram last week of me not using a rebozo, but my hands were crisscrossed on the mom, and we were doing a tug of war with the mom. But that can be really stressful. I think that actually probably broke my neck, that lovely position. I think I herniated some discs in my neck on that day. I held that horse position for about 45 minutes. Wow. But this would be really useful as well, right? So the laboring person is pulling back, because when you pull, you can push with great force, and it kind of curls you around your baby and gets all that force in the right spot.
And she's really connecting to her pelvic floor and her pushing when she's in that position, bearing down. Yeah,
so it's really helpful. So some takeaways from today are, one, doulas are awesome, and they are very useful in hospital and out of hospital for a variety of reasons for the laboring person and the partner. They also are really good to run interference. They will never speak on your behalf, but they'll advocate for you and help meet with you ahead of time and hear what your birth plan is, and then just remind you throughout the care of what your birth plan is. And I don't know about you, but when I was doing labor support, I would also interface with the family, with the mothers, with the laboring person's permission. Is it okay if I let your mom know where you're at? Is it okay? And then we sort of can keep the anxiety level in the room down a little bit by saying, oh, she's doing great. Everything is great. So doulas are really good for helping communicate and helping explain what's going on. Birth balls are your friend. Everybody should have one. They're awesome. Peanut balls, which we're not using today, are exactly what it sounds like. It's this big ball that looks like a peanut, and they're really great, especially with epidurals, to help keep that pelvis open when you're laying on your side. So they bring all the tools. Many of your hospitals will have those tools. And then some basic, lots of massage. So your partner, if you aren't going to have a doula or a midwife, then go on YouTube and look at some of these, that double hip squeeze and where that massage should be done and how to use this rebozo. You can also call us here at the Birth Center. We're happy to refer to, there's there are doulas all over. We have lots and lots of wonderful doulas around.
And it's great to take a childbirth education class that's led by doulas, because then you're going to learn your own comfort measures for your own toolbox.
Are most childbirth educators doulas? I would think they mostly are.
I hang out with are.
I mean, it's really common that your birth, and we recommend that you do a childbirth class if you're birthing in the hospital, outside of the facility where you're delivering your baby, just so that you can get another perspective, that there's no conflict of interest. We want to make sure that you're given all the information of why natural childbirth is appropriate. Because remember, you still have to, ideally you labor, you're going to have labor, even if you choose like, oh no, I don't want natural childbirth, I'm definitely going to go in and get an epidural. That's cool, that's fine, but you hopefully will have some labor, because you're going to either spontaneously go into labor and have some contractions, and they won't admit you to the hospital most likely until you're 3-4 centimeters. So you do have to get from 0 to 3 or 4 centimeters, and for some that can be very, very challenging. And
some people plan to not have an epidural and for various reasons need one. So having a doula there for that emotional support, reminding you that it's okay and that you've done your best, and that these are good informed decisions, and you really understand every step, can be very valuable. No one is trying to talk you out of a doula.
Not a doula. No one's trying to talk you out of that, but nobody's also trying to talk you out of an epidural. So having the doula there is just, it's someone say, hey, let's try this position, let's try that position. Do you feel like you've done everything? Can you do 30 more minutes? No? Well, then let's get that epidural going. It's really awesome. So that's our 2 cents on comfort measures. Forward-leaning positions, getting a birth ball, getting a rebozo, finding what oils smell good to you, downloading some music that's really comforting to you, affirmations, Bible verses, anything that works for you, earbuds in labor, a mask in labor are really helpful, so that you can go into that dark place and tune out the sounds around you, are all really helpful as well. I hope this was helpful for you guys. Do call, ask us questions below here, follow us on Instagram.
We have a takeover today, this week, Wednesday.
We have a takeover on Wednesday. I think that's something fancy. On our Instagram account, I believe it's Ray.
She's going to do a giveaway.
Oh, we're going to have a giveaway. So that's super cool if you follow us on our Instagram account, SCV Birth. And what worked for you in labor? What were some of your favorite comfort measures in labor?
What are some of the favorite things you brought to your labor?
Yeah. Did you have a doula or no? So we would love to hear from you guys. Okay. Thanks. See you next week.
Thank you.
Bye.